I would like to tell you about patient named Carlos, and Carlos is a 62-year-old female, and she has been undergoing chemotherapy treatment for her leukemia. After several rounds of the chemotherapy, she just was not responding like she should. Her oncologist started to review things with her and was inquiring about many different things. He said, "Now you are not taking any other medication, right?" She said, "No, I don't take any medication at all. The only pill I take every day is St. Johnson's words for my depression." The oncologist said, "Oh, really? Well, that actually doesn't count as a medication." Unfortunately, St. John's wort was found to be what was interfering with her chemotherapy. Unfortunately, this can occur with the use of botanical. There are the many instances where botanical can potentially harm patients. So we need to really careful about these practices. We will learn more about special patient population in this video. Patient may seek out botanical for many reasons, such as a desiring less cost or fewer side effect, or maybe they just want to take a more natural approach to their healthcare. There are the certain population of the patient, however they may be more vulnerable to harm from botanical, and you should generally avoid recommending botanical to this group. It's important to be able identify this special patient population and exercise proper prescription anytime you are considering recommending a botanically special population. They are particularly susceptible to the adverse reaction that with botanical include infant or elderly, immunocompromised patient, pregnant or breastfeeding women, patient with impaired kidney or liver function. Perioperative patient are those patients who are taking multiple medication. Both infants and elderly are the more susceptible to patient side effect and toxicity from pharmaceutical and botanical. Elderly patient may have also multiple medication concern and be the long list of pharmaceutical, making this riskier patient population in which to use them. So just remember the extremes of the age, and the very young, the very old. Botanical should be used with caution of at all. Immunocompromised patients have a weakened immune system. This may be form of medical condition or perhaps due to medication that they may be taking. Example of immunocompromised medical condition include cancer, autoimmune diseases, organ transplant patient, and HIV patient who are the steroid or the other medication that suppress the immune system, such as for rheumatoid arthritis or inflammatory bowel disease, are also considered immunocompromised. This is the concern because these patients are more susceptible to infections and other illness. In addition, these patients tend to be pharmaceutical that have a very narrow therapeutic window, so they are likely to have multiple risk factors for herb drugs interaction. Women who are pregnant or breastfeeding are often consuming botanical with the assumption of they are safer. It's true there are some botanical that have been well studied to safe in pregnancy and breastfeeding. However, there are the many that carrying increased risk of miscarriage, birth defect, and have other harmful effect on this fetus. So breastfeeding child for a large portion of the botanical we simply don't know, and that what make this is challenging. There is not a lot of research that done pregnant women for a simple reason. It's really risky population to perform experiment on. This mean we often don't know that botanical may affect the mother of the boy. Maybe a good rules of thumb that I always follow is, when in doubt, if we are not sure how it's going to affect the mothers or the child, it's best to simply not use the botanical. Both the livers and kidney are the organ in the body where a lot of the medication are metabolized. If either the kidney or liver are not functioning optimized due to disease like trauma and previous surgeries, that this will impact how pharmaceutical and botanicals are metabolized in the body. It can potentially lead to increased level of toxicity. If you are a family member have ever the surgery, you know surgeon will want to know each and every medication the patient is taking beforehand. Many people truly forget to include supplement or botanical when discussing this with the assumption that since the product are natural, it will not be cause any harm. However, many supplement and botanical can increase the risk of bleeding, which is really important thing. No, before a person has surgery, make sure that always ask if a patient is taking supplement or botanical and disclose surgeon and team. It may be impact patient care.